Thank you for giving me opportunity to present our work. And I'm Zhao Mingliu, Liu Zhaoming in Chinese name, and I'm a professor in Department of Nutrition School Public Health, the Sun Yat-sen University. And I'm very happy to introduce my study. And it is a case control study conducted in Chinese elderly. And we look at the associations between habitual resveratrol intake with the risk of hip fractures. And this is my email address. And if you have any question with my study, and you can email to you, I'm very happy to respond to any your questions. And the content include the research background on bone health and resveratrol, and then our study aims, and then its methodologies, including our study design, the participant enrollment, and also data corrections. And then I will present our results and give some explanations on some special issues. And also I will present I will elaborate the study implications, novelty, and also the limitations. And finally, I will give conclusions and the future directions for the research. And first is the research background. And you know that the bone mass will increase from the fetus till adults, and the bone mass will achieve the maximum at around 30 to 35 years old, which we call the peak bone mass. And then once achieved the PBM, the peak bone mass, and the bone mass will gradually be reduced with increased age. And often the males have higher bone mass and higher peak bone mass than the females. And so the interventions uh, for for bone loss or fractures can have two stages. The one is the early of life, and we can maximum the PBM, the peak bone mass, and to retard the bone loss. And the second stage is on midlife and the elderly period, and active intervention on this period can reduce the bone loss and reduce the bone loss and reduce the fracture risk. So although both men and women are susceptible to a bone loss with the increase in age, but this situation is serious for women because after menopause, the bone loss reduced quickly at the menopause and with the decline of their estrogen level. And osteoporosis is characterized as a reduced bone mass, and also simultaneously have some deterioration on the bone microstructures, and which will reduce the bone strength. And the serious complications of osteoporosis is the fractures. And of course, the fractures can occur in all the bone sites, but hip fractures is the serious one. It's the most serious one, and because hip fractures hip fractures can bring about excessive short and long-term mortalities, and the studies have shown that the one-year mortality may be achieved 70% if without the surgical interventions. And also hip fracture will bring about serious disability in elderly and severely decrease their quality of life. And hip fracture also bring a huge healthcare cost in society. And the common site for hip fracture is the femoral neck fracture or the intertrochanteric. First, I will
Okay.
summarize our findings. And our
Mm-hmm.
participant had a relatively low habitual resveratrol intake, with the major sources from the grapes, nuts, and apples. And we found that the higher habitual intake of total and individual resveratrol, as well as the resveratrol-rich food, were those responsibly associated with lowered risk of hip fracture. And the association seems more evident in female population, and for also the participants of normal body mass index. So I give some explanation on because our participant has a low intake of resveratrol, and you may think why such a low intake resveratrol may still have significant protective association with the hip fractures. And my response is that although it is a relatively low amount, but the consumption of resveratrol is on a long-term regular basis. And because compared with Mediterranean countries like Italy or Spanish people, and the major resveratrol source for them was from the red wine. But for the Chinese people, Chinese elderly, and our participants had more than 90% of our participants has no regular wine intake, and resveratrol may also is also the food metrics may also play a role in the effectiveness. You know that some studies show that resveratrol had some possible synergistic effects with other food components like the other phytochemicals or bioactive components in the diet. So we further adjusted this dietary fruit intake, dietary vegetable intake, and other healthy lifestyle factors. And this adjustment make attenuation of the regression model, but the results still remain significant and implying the independent effect of resveratrol on the bone health. And another reason is that resveratrol have multiple targets and they have multiple bioactive properties like antioxidant, estrogenic, anti-inflammation, etc. And even if we use FFQ for assessment of dietary resveratrol intake, may result in some misclassification and for the but this kind of misclassification is differential and only attenuated associated